but we do our best to work with family members. We do our best to work with the individual to try to move through.
Well, thank you.
Rich, do we have to unmute for them to hear us?
No, they should be coming through the hall.
Okay.
Does anyone else have any questions? I do. Did you attend the suicide prevention forum on the 27th of April? You were Scott.
No, we were up at training. We also had suicide prevention up there also.
It's as part of that other
Yes,
training.
we cover suicide prevention. At least 2 to 3 months. Every 2 to 3 months, we cover suicide prevention.
Thank you.
But there is another one coming up. I didn't write down. There's a couple more that are coming up in the next couple of months that we're going to be attending through the WDBA.
Okay, so in other words, you're staying on top of it.
Oh, yeah.
Okay.
It's,
Terry, did you have something to say?
Yeah, I was wondering if there's any help with getting in through the honor flights for some of these veterans here. Do you guys help out with that, or is that just on your own with the families?
we just, if they need help filling out the application, we help them with the applications. Yeah, we have nothing. That's a private, the honor flights are private, put on by a private company. We just help the veterans and the families if they need help with the application and getting to the right location where they want to fly out of.
Thank you.
One more question.
Go ahead, Josh.
I suppose I'll just tell you, maybe the whole board here. It's been brought to my attention that there's a issue with space in the Health and Human Services Department. And we have a building in Grand Marsh, the former Grand Marsh School, in great shape there. I'm wondering if we could somehow utilize that building for Health and Human Services or a division of such. That would be helpful. You know, for example, we have issues with drug and alcohol addiction running rampant in this county. And there's not enough area, and in my opinion, for anyone to reach out to get help in those initial stages as it is. Why don't we utilize the space we already have and better the people of the entire county and the welfare involved.
Supervisor, that is not on the agenda, so we can't discuss it.
Okay.
And you might be better served if you were on the agenda for, was it property committee, would that be it, or building?
That's tomorrow. I'll have that.
Okay.
That's the fair than that.
Yeah,
Thank you.
okay,
I will.
very good. The Veteran Service Office vouchers and financials. Have you all had a chance to look at it? Do you have any questions?
We're having a little technical difficulty with the heating and cooling. Can somebody give maintenance a call?
Didn't feel like it.
It's just making a lot of noise. For those of you who are not here, it's just on and off, on and off, on and off. So I'm sure it's hard to hear. All right, sorry.
Okay. Any questions? Okay. Motion to approve vouchers and financials. Gordy,
I second it.
motion made, seconded to approve. All in favor, say aye. Opposed? That's it.
Yeah,
We
we
already
know that.
mentioned that.
Yeah, if you guys have any questions on it, let me know.
That's it. Thank you very much.
Thank you. Yeah, thank you.
Okay, the financial report. Who's doing that?
So Wendy is on and Wendy will be doing our financial report. Wendy?
Hi, I would just like to mention mostly for the benefit of the new members, as you look through our financial revenue and expense report, that due to the nature of our funding sources, our revenues lag 3 months or more behind our expenses. So when you're looking at the year-to-date expense and it looks quite a bit higher than our year-to-date revenues, it's most likely due to those lagging revenues. And I just want to say, feel free to ask any questions you may have.
Anyone have any questions today?
So I was able to go over some of this with Kelly, so I appreciate that. Thank you.
Yeah, hearing none. We don't need a pool on that, do we? Okay, the vouchers. That you again, Wendy?
If we need general questions, we'll try to answer.
Any questions on the vouchers? Hearing none. I'll take a motion to approve those.
First, we move to the-
Question, when they do an hello?
Hello?
Yeah, when they do a elderly abuse at like the Adams Inn and stuff, is that just real spontaneous and we need to put them in a place where children are abusing their parents?
need a second before we can discuss it.
Kelly, do you want me to answer that or?
Oh, can you wait just a minute? We need a sec. Okay, we've got a second on the motion. Now we can have discussion.
Sorry.
It's okay.
Go ahead, Diane.
Okay, Terry, on the board, generally when we get an adult protective services call from the sheriff's office, they're usually of various reasons. It might not be necessarily adult children neglecting their parents, but there's a various numbers of reasons of why we might get that. Generally what we do is we'll go and either contract with the any of the hotels in town if they have availability, and then in the morning we'll sort this out.
So it's mainly possibly an evening problem or whatever that goes on?
Most of the time it comes up sometime during the evening or early morning hours.
Yeah, I'll make sure I watch over that with my dad.
Oh, I'm sure you will. Thank you. I'm sure you will.
Are there any other questions? Okay. All those in favor of approving the vouchers, say A.
Aye.
Against?
No.
Okay.
No.
Okay. Osdowski says no. Okay, motion carried. Director's report, manager narratives.
We have our narrative up there. Did anybody have any questions about the written content in the narrative?
I don't see any questions, but I do want to compliment your managers on the reports that they did write up this month. It was very informative for, I think, some of the new members of this committee
Yes, sir.
to understand what's going on. So thank you, all of you. Anything here?
I don't have anything else to add if there aren't any questions.
Moving right along. Project status report.
So Ruth will pull that up. We try to report out on this every month. These are kind of the bigger projects or tasks that HHS is working on. Keep in mind that we have 9 smaller divisions, so these are maybe your larger projects. The first one is updating our department policies to reflect trauma-informed care practices. We did another round of surveys the end of April to see how we're doing, and we had positive results again. In a couple months, we'll share our results as we did, I think, 3 months ago, possibly. So we'll review those again with the committee. Developing family-centered treatment. Erin, the highlight that I had is that Erin has applied for additional funding from the state to cover any additional costs this year, in addition to supporting the Titan Youth Group. So it's very exciting that we'll get a little additional dollars to cover some costs. Purchasing the 5 fleet vehicles, that's still waiting for vehicle availability. No changes there. Increasing our internal CCS service array. No new changes. We did onboard our coordinated service rehabilitation worker at the beginning of the year, and he certainly hit the ground running and is able to reduce some of our contracted services. And then working towards becoming more paperless. I think the last time we reported out the new fax process has really improved our efficiencies, and has reduced another way of reducing our paper. And then ongoing support for telework, and that continues to be monitored by managers and myself. Any questions about those projects?
Could you tell me what Titan stands for? Is it an acronym for something?
Yes, it is an acronym, and I will tell it to you in a minute, unless Erin can do it faster.
Sure. Teens initiating transformation among neighborhoods. One of our highlights.
So for those who might not be familiar with Titans, they are a teen group that works with some of the Erin's staff and children and families and some of the coordinated services staff. And they do community service in the community. They're often looking for projects also. So if you have some ideas and that's something they can fit into their schedule, they will do that.
Okay. They are looking for projects if there are some.
I could report a little bit on that. I didn't get to actually see them because it was the same day we had the meeting, but they did come out. I think there was 5 or 6 of them that came out to the park and did a bunch of raking and picking up sticks and stuff. I actually met them. I was going out there when they were coming back, so they got done before I got back. But they all worked good, did a good job. No arguing, went along good, I guess, just from what I heard from reports. So
Wonderful.
I want to thank you guys for getting them out there. That was really a big help.
Good, good.
How do they get into that youth group?
One of 2 ways. One is through Diane's staff. They're working through CCS. Or if they have a youth justice referral and they're involved with our agency and they meet certain criteria as far as risk level. Maybe they don't have a good group of peers, they don't have employment skills, or just don't see the need to help out in the community. This is one of the parts is the community service project. The other portion is they get together and they go through some curriculum, really looking at ways they could handle situations better. They come up with the project, like here's some projects we can pick from. They then decide what they're going to do the following week. And so it has been a lot of park cleanup, some individual homes. They've done some cleanup for some elderly neighbors. There's some highlights in there. Over the winter, they kind of ran out of projects because it wasn't nice out. But they did cookie decorating for Meals on Wheels, just things like that to fill the gap. And really got to know some elderly folks in the community. So it's a win-win.
Is there an age determination?
It tends to be teenagers. So for our purposes, they have to be 10 or above. I don't know if there is for CCS, but they have been young teenagers between like 12 and 17.
And my last question is this for teams countywide? Because there's
Yes.
4 school districts in the, so it's totally countywide?
Yes, and that's one of the logistics is we've got kids all over that have to be picked up and brought into town.
That was my Mark Hamburg question.
I think it's a good question because for the park cleanup, we did have some youth that were coming from all the way down by Oxford, so. Yep. So they cover the town.
Okay. Thank you.
Are there any other questions? Okay. Where are we going now, Kelly?
10. Supportive committee members. I don't know if anyone who sat on any of the committees has anything else to report. I think we gave a report the last time these committees met. If there's any questions.
No, not. Okay, public health update.
Yeah, so our COVID-19 update, May 1st, the first of the month, we had 5 active cases, which is awesome to hear. There has been a little bit of a surge going on. I'm not sure if it's because there were a couple of events that, were going on in the community and county. We did dip up into 45, but right now we have 13 active cases for the week, which is nice to see. And the highest age group being affected is 30 to 39-year-olds. And Adams County is currently and is doing really well, staying in the low category. So, and then with reasons of the policy ending and changing, this will probably be the last update moving forward. So,
Very good. Then you can report on something else that you're doing.
of course, we got a lot of new programs coming out, so we're really happy to be working on that. So.
Very good. Any, oh,
What days are you doing vaccinations yet?
Yeah, so we moved them to doing them 2 times a month now. It's still on Wednesdays from 2 to 4:30. Anything after 4:30 is by appointment. So, and then in June, we'll be doing it 1 time a month. And then if there were to be like a surge or something, we would open it back up to more times a month. So, but yeah, every Wednesday. But moving forward, it's going to be the 3rd Wednesday of the month.
You're still posting that on Facebook?
And the first, yep, it'll be on all of our social media. So,
So when is your next one? Like 18th?
it'll be the third of 3rd Wednesday. So that is the 18th, correct? Yep, there's the next one. Was there another question?
Yeah, I had a question. It seems a lot of focus has been put on COVID-19 still, and I realize there might have been some issues, viruses. That all aside, don't we feel that there's bigger issues to be worried about and concerned with at this point, such as mental health and the mental health problems that have been caused, drug and alcohol abuse that has been caused as a result of locking people down and suppressing people for the last 2 years?
Sure.
This has had a major effect on our youth. What are we doing about it?
Yeah, so almost every issue that we come across from public health is a big issue and concern for us and my team. Mental health is a huge focus. I'm not sure if you read our CHA yet, our community health assessment. We're actually doing a big, using a lot of our big grants to do a lot of marketing for males with mental health and mental wellness issues. And then we're also converting that into our school districts to kind of target the young population too. So there's going to be a big campaign moving forward to working on mental health. And my coworkers and staff members are actually working on that right now to get that going. So, and I can also provide you more feedback, later on in the week or in the month if you want to know like exact details of what we're doing. But it's a big concern of ours, and it's actually one of the biggest priorities right now that we're working on. So.
You have the facilities to accommodate this increased demand for mental health.
Yeah, I mean,
You have the
our team is working really well on it, and we're actually going to focus groups. So we actually targeted other community members, departments, townships, and business leaders, key stakeholders. So we're using all of those members to kind of push that focus moving forward. So yeah, our community groups and action teams are working on that right now as we speak. So.
And Cody, I would just add one of your focuses with public health is helping to fill gaps and bringing the attention and awareness that there is a gap and helping to improve access. That's one of the main focuses of your health improvement plan is to identify the gap and then come up with some ideas to fill those gaps.
Thank you.
Okay, I got a question.
Okay, go ahead.
So real quickly, it was from 2 to 4:30 on Wednesday for shots for the last booster shot at the social service building.
Correct. Yep.
And then, how are things going out? I've got some grandkids that are starting to get, the COVID at 1 year old. How is that in Adams?
So, yeah, for vaccines right now, it's not approved yet. There's still been talks with my state calls, and the state doctors that they're working on some guidelines for that, but it hasn't been, approved yet. So there hasn't been much focus or movement on that for our county, other than raising awareness. But there hasn't been anything vaccine related for that.
Okay, so how serious is that for a 1 year old?
I mean, each individual is different. Being young, they have pretty good immune systems. Can't speak for chronic conditions or anything like that. But just being mindful of social distancing, Germ-X, washing your hands and stuff like that will go a long way, so.
So if they're teachers and they are, their 1 year old at home has a COVID, are they allowed to go in and teach?
Basically with the school and the policy that we have the 5-day guidelines with those. So if a teacher is vaccinated and is not having symptoms, they can mask and still teach. And then if they are not vaccinated and are displaying symptoms, they shouldn't be coming into the school system for our county.
Thanks. I think they had the information right, but I had to get it verified from the experts.
Sure, and I know it changes all the time, so if you have any questions, feel free to give me a call or email me for more clarification too, so, thank you.
Thank you.
Does anyone else have any questions of Cody? If not, thank you, Cody.
Thank you.
Annual
Looks like
report,
you.
huh? All right. Bruce, you want to hold the annual report? So, for Rich's sake, we'll only go through half of it because it's a 52-page report. The first couple of pages are what you would expect in our annual report. And we'll start off right away as a reminder that there's 3 sites for Health and Human Services. We do have the thrift store, in addition to the main building, and then Donna's team are over at the community center. Half of them are located by extension and the other half are off of the large community center. The next page will be our organizational chart. So you have an idea of how we're structured. There we go. There's our organizational chart. And then going into page 7 is our 2021 accomplishments. I just wanted to highlight a couple more broad accomplishments, and that's that we continue to reprioritize our essential functions throughout the duration of the pandemic. Hearing from Cody now, maybe we're finally in the point where we're going to be able to transition out now in 2022, but 2021 definitely brought a lot of changes and constant adapting to program changes for our staff and our managers. At the beginning of 2021, we transitioned into a new and updated electronic health record. We're required to have an electronic health record, and we were able to upgrade into the Echo eVantage, and that has really improved our efficiencies. We have realized significant efficiencies with it, and definitely improved data collection. Also, we continue to seek grants and other revenue sources to support the department. That's something we do every year. We are always looking for alternative revenue sources to offset our tax levy wherever possible. And then one of the things that we were proud of was our ability to support the hybrid telework schedules. We were able to realize program efficiencies, and we were still able to ensure that benchmarks for our programs and our standards continue to be met. And in many cases, we exceeded those benchmarks and expectations. So we're very proud of our staff for being able to do that. And then each division has accomplishments. Those are more specific to the divisions, and I'll let you guys read through those. We'll send a link to this after our meeting. So you can read through it, and then when we review the other half next month, bring any questions you might have. And then we'll move into aging, page 9. And Donna, feel free to jump in or whatever I miss. Donna Richards is our aging and ADRC manager. So she's responsible for a lot of programming. Each area in our annual report will tell you a broad overview of some of the programs that they operate in addition to how they are staffed. This table here highlights that Adams County is one of the oldest counties. We're the 4th oldest county in the state. It looks like nearly 31% of our population is 65 and older. This would indicate that our aging programs definitely are going to continue to be necessary and needed, and we'll need to continue to invest in those as the population continues to age. I should note that the statewide average for 65 and older is 18%. So Adams County is definitely much older than the average in the state.
It should be pointed out too that some of our state funding is based on overall population, not population of our seniors. So, so sometimes that is a hindrance in how we get our grant dollars, is because it's not reflected as the seniors grow older.
Moving down. This is a chart about our home delivered meals and dining sites. Many of you know that the dining sites were closed in 2021. There continue to be home delivered meals and our family care meals. The family care meals are the light green, and those meals generate revenue. The full cost of the meal, including the preparation of the meal, is covered in that meal. So our ability to contract with managed care organizations to provide that service helps us to offset other costs. Resource contacts, so that would be 2 for the staff that are in Donna's ADRC. These are the contacts that they had over 3,400 contacts in 2021. People looking for services and supports, maybe information and assistance for maybe aging parents or neighbors they were concerned about, options counseling. They provided 127 functional screens. That is, you heard Rick talk a little bit about dementia, people needing to go to King. This is for different types of enrollment in the long-term care programs. Our transportation rides really decreased in 2021. That was really in part to not so many consumers are going to the thrift store for services because we were limited with how many clients we could have in there. Some of them also have significant physical conditions, so we have to be careful with COVID. What were some other reasons, Donna?
So some of our other rides include picking people up to bring them to the dining site, or so and taking food to them. You know, we pick up their groceries and take them to their homes. So some of our other rides decreased because we didn't have our dining sites open. So those are some of the other rides that we did.
Keep going, Ruth. So this is our in-kind volunteer hours. And you'll see that our volunteer hours really decreased since the pandemic started. The pandemic really reduced our number of volunteers. Many of those volunteers moved away. Several of them passed on. Some of them developed health conditions, and others found a different way to be part of the community. But we depend on our volunteer hours because it offsets our match for many of the programs that are operated in Donna's division.
Right.
So if you scroll down a little bit, every hour of volunteer time counts as $25.11 for in-kind match. So those volunteer hours are very important to us, and figuring out how to increase volunteerism is very important.
Yeah, our volunteers, we have administration volunteers, so people would actually come in and help us with phones and things. We also have volunteers who come in the kitchen and help serve and so forth. We have volunteers are critical for medical rides, to get people back and forth. So our volunteerism is huge for us, and most of our aging programs heavily depend on volunteers. So without the volunteers, we've really had to kind of revamp how we do things, but we really need to get our volunteerism back up. And like Kelly said, our budget depends on that. We really look at our in-kind. That helps with our match, and that helps reduce our cost to the county levy. So we're putting out marketing and advertising, and we're constantly asking for volunteers, so.
So if you know anybody, send them Donna's way. Keep scrolling around. And then right here is a chart that we found really interesting.
Yes.
You'll notice on the left-hand side, Adams County is the oldest county really in central Wisconsin. That's according to the 2020 data that they have from the Department of Administration. And in 20 years, we're projected to be the oldest county in the state. They are projecting by 2040, 40% of our population will be 65 and over. That is a significant increase. It's something that we need to be thinking about as we move forward with our budgeting and our priorities.
So we've been kind of a leader in that department.
You are a leader, an innovator.
Wow.
And so it's important because, you know, we need our younger people here to help support the older people then. And so in order to support that many elderly people, we have to have some resources here. So it is something that the county really needs to look at and be fully aware of, that this is something that needs to be planned for.
It continues to be important that we figure out ways to bring back our talented youth into the community so that once they go off to school or go on to the workforce, they don't leave the community. We want to make sure that we have a workforce to take care of us. Sure.
Can anyone tell me what we're doing to create jobs to attract the middle class youth, especially to the area where, you know, jobs and housing, it seems that all this is a problem in this county.
I think, you know, economic development is really taking that on. I know the school district, and I don't want to hurt Supervisor Pease or anything like that, but our local school district here has worked really hard at allowing businesses to come in and speak to our students about what's available here and different career paths and
Mid-State's been doing like admitting the entire senior class so that they can try to stay home.
One of the things that's been successful for us is taking on high school kids and giving them an opportunity to shadow here. And then they want to come back, they come back on breaks, and hopefully they return, or creating an opportunity where they feel like they have advancement.
I can speak to this a little bit too, if you don't mind. Couple things. I know the school district and the county and YMCA are trying to get some childcare going. The YMCA especially, seeing it's been so successful that they're already talking about building on so they could have a 24-hour childcare. Also, this morning in finance, we put forward to the board a $100,000 thing to Mid-State, possibly to help them build a manufacturing and upgrade our current Mid-State here, to keep people here to learn jobs here. And also there'd be a shuttle service up to their next portion, to Mid-State in Point. I told the board last year during a budget meeting that we need to start looking at trying to keep our 20 to 40-year-olds here. And I think this morning was a good way to start that, and we'll continue that. But housing will always be an issue here until we figure out where we can get a developer to come in to do some housing. We're not going to build smokestack factories here when our average age population is 56, because we're a retirement community. So we got to be happy with jobs, with people that come in and start jobs with 10 to 20 people at a time. We're just not going to get that General Motors to come here anymore because we're too old. So we have to realize that.
Thank you, I appreciate it. But my my question to that is, now, who declares us a retirement community, and how is that gonna be sustainable?
It's not.
Right there. The numbers right there, that's how they.
Well, the census just showed, that we are 56, an average age is 56. And that's a struggle for us.
That should show everyone that there's a problem attracting the younger people here, and we need to address these issues strongly somehow.
So
That's what I'm saying.
if I can mention a little bit with Sand Valley out in the town of Rome, I mean, that has to create a ton of positions and jobs and stuff throughout the whole year.
Not a ton, but some.
Mostly seasonal.
But this is a discussion that should go somewhere. It's not on the agenda again.
Thank you.
Thank you though for your comments.
You're welcome.
Any other questions for Donna? Moving on to Behavioral Health Division. So Ruth, if you're gonna scroll down, this colorful chart here shows that in 2021, our crisis call center took 507 crisis calls. Of that, the majority of our individuals accessing crisis services were able to be stabilized in the community using community supports and safety planning. Of all of those calls, about 9% of those individuals required an involuntary emergency hospitalization. So that means they met their criteria, that their mental health crisis was at such a level that they were a danger to themselves or others. And 4% were voluntarily admitted. That means they still meet their criteria for an involuntary hospitalization, but they chose and they understood that they were in a position that they needed to go to the hospital. And just under 2%, of those calls required involuntary treatment for alcohol or drug intoxication or incapacitation.
Supervisor, go ahead.
What are the criteria for somebody to meet where they have an emergency detention?
I can actually get you a legal form if you want to do that.
Is that, I mean, if they're beyond the point of being able to decipher right from wrong and think for themselves, everything I see is jail as their only option. Is there something in between there that we can stop this from escalating to that point where they're endangering themselves further?
Well, our hope is that we can, by creating access to psychiatry services and counseling and some of those earlier interventions, that we can prevent it from becoming full crisis.
No, it's beyond that point. So you're not answering the question.
Yep.
But it's beyond all that early stages. They go in there on their own to get help. This is beyond that. They're no longer able to think for themselves. They're basically having a mental health crisis. Is what they call it nowadays, but I mean, there's other forms. But what do they do? They're not able to go on their own behalf.
That's when either there's the incapacitation, whether it's for drugs or alcohol, and that's a law enforcement decision, or the emergency detention, and that's when they have to meet the criteria of Chapter 51. When we send this out to you, Ruth, if you can scroll down a little bit.
But just to clear up, there's nothing a family member can really do in this situation other than law enforcement.
Could continue to help them access services, to give them information access services. You can always reach out and say, this is what I have at home, I'm concerned about it. And we might be able to reach out. There are different opportunities that we have. But sometimes it has to be a full-blown crisis before the individual is willing to take that.
So you're basically saying that they have to find of some kind before they'll be taken in for treatment. I mean, this is in a severe circumstance where they're no longer able to think for themselves.
They don't always commit a crime to be hospitalized. It can be the nature of the threats that they're making, the severity of the threats that they're making, perhaps the plan that they have. others to harm themselves or others.
I'm aware of the 72-hour mental health hold that put on an individual. It seems they'll do that for a few days and then they release them. And a week later, they're right back where they started because they're not getting to the root of the problem. Getting the proper treatment.
So that could be part of the same frustrations that we have with the 72-hour hold. A lot of times it's up to the facility to determine if there's a necessity to hold them longer. And then you work through a whole crisis process, a legal process, where a judge has to help make that decision whether or not they can continue to stay in the hospital against their will. And then there's commitment orders where a judge can commit someone, but it's all based on what the finding is of the facility for how far they.
Right. So just to clear up this, the family really has no say at that point on what happens with that individual. It's up to the state or that individual office entity.
The court. It's always the court has the final say.
And in a situation like that, how do we even, I mean, in a crisis situation, how is there even time to address courts? There's not even time.
Because if it's an immediate crisis and law enforcement gets called, that's how it activates the emergency crisis system. And the emergency crisis system is available 24/7. So whoever is on that, whoever receives that call, they're making that determination, doesn't meet the threshold for an emergency detention. Doing an emergency detention on someone, you are essentially taking away several of their rights to be hospitalized. It's a very big decision. And it's one that can't be taken lightly because, you're taking away their civil liberties. They're going to be locked in a facility until somebody tries to come out. So there's a very high criteria that they have to do.
Yeah, my question is, why should several family members have the ability to do so?
I don't get to make those decisions.
I mean, that's just, I'm asking.
My hope is that there's a lot of work right now being done and a lot of advocacy happening for the crisis system, whether it's from the Sheriff's Department or the Hospital Association, the Wisconsin Human Services Association, to really revamp our crisis system because the system isn't always as effective as it could be. So right now, there's a big movement to try to change it, create more opportunities for crisis stabilization. Because when people go to the hospital, that's not the best. That's not the best outcome. That is the worst outcome. Because really serving people in the community is the best for the individual, and it's the best for the community. However, there are times that it's necessary to hospitalize someone. So revamping the mobile crisis system, I'm sure something the Sheriff's Department would love to see. It's very time consuming for them to always be on the back end of the crisis. So all I can say is join the advocacy movement and get your voice out there. But we are hopeful that there will be some positive changes and hopefully it's a funded change. So a lot of times these are unfunded services.
Yeah.
This sounds like it's a very personal matter with you.
Well, I'm here and I see a lot of it in the county,
I'd suggest that you set up a meeting with Kelly and
We have
select members of
spoken.
her staff
Yeah.
in order to cover this to your satisfaction. And, she has to bring in the Sheriff's Department or whatever, so that you can get your answers.
Sure, yeah.
You could become an advocate for the people.
I'd be
that
happy to do
suffer.
so. I mean, I'm here for the people and best interest of everybody. So that's why I'm here. That's why I got elected. Thank you.
Okay, thank you.
Okay, so those are our crisis calls that went through our telephone support system. Keep going, Ruth. So these are the hospitalizations in, well, you can see 2018 to 2021. So we had a decrease since 2018. You'll see that we have the same number of hospitalizations from 2020 to 2021. However, the cost for hospitalization rose. In part, that's due to the number of days individuals are hospitalized, because it's not always 3 days. It can be a whole lot longer than 3 days. As well as the actual daily cost of hospitalization has increased. Keep going. And then here's a number of individuals that we're serving in our programs of behavioral health. I know that might be a little hard for you to read. But we're providing several services in our Summer Behavioral Health program. We had 422 people enrolled into our crisis program. We have 30 crisis commitments. That is the most significant legal order that can happen on someone who is emergency detained, as well as 22 settlement agreements. We served 243 people in our psychiatry program, just under 260 with mental health therapy, 106 people with substance use disorders. We did 91 intoxicated driver program assessments, and we served 66 people in our medication management program. Now that medication management program is for individuals who are unable to consistently take their medications to manage their mental health conditions. So they are dependent on us to come in to get their meds. Sometimes it's 5 times a week, sometimes it's once a week, sometimes it's just an injection. But we're seeing a lot of success with our serious mental illness individuals. When they're getting an injection, it really improves their medication compliance, which means they are a lot healthier. And some of these numbers could be duplicated because individuals may be getting services in a variety. Just to point out that we are constantly getting referrals for services. We are not able to meet all of the service referrals. So the cases that are not as intensive require as much support. We do refer out to other community providers. And all of those services that were on that chart are revenue driven. And we are able to claim some dollars for the max allowable or possible. But we do have a requirement to serve people who are underinsured or uninsured. Any questions about that? Okay, we'll do 2 more. Children and Family Services is our next division. Just a reminder that they have a responsibility and they do have staff on call 24/7 and 365. They have a requirement to respond to child abuse, neglect, or youth justice issues. This chart shows that our costs for out-of-home care. When I met with Supervisor Pease, he had asked a question about how our budget can fluctuate so much. This is a prime example of how our costs can fluctuate. You'll notice in 2019, our out-of-home care costs surpassed $1 million. So those are for kids who are in foster care, group home, residential, corrections, or kinship. In 2019, we didn't necessarily have a crazy amount of children in care, but some of their costs were very expensive. A day in juvenile corrections used to be about $615 a day. It is now over $1,100 a day. So $1,100 a day for one kid, very, very costly. So one youth, if he or she went for an entire month, is going to be close to $400,000. The same can go for our residential placements. Those are very, very costly. We had a youth who had a placement that cost over $800 a day. So children and families relies heavily on coordinated services. You'll hear about that next, for a lot of supports because they help keep youth in the community. So cost effective, and it has much better outcomes to keep our kids in the community than to send them to out-of-home care. You'll notice that the number of alleged victims has decreased. These are just the number of individuals who are being assessed. This is not the totality of what's being referred. Again, we can really contribute that the number has decreased as increase in access to community services has improved. We also had a decrease because fewer children are being seen during the pandemic. Just when schools closed, obviously teachers are one of our biggest reporters, so if teachers aren't seeing the kids, we have fewer reports. Moving on, coordinated services. And I didn't introduce Erin, so this is Erin Schiffrel. She is our Children and Family Services Manager. Coordinated Services, Diane is on the call. She's in her office. She's our Coordinated Services Manager.
Hello, everyone.
That was Diane. So Diane's division has several programs. You'll notice in your packet, we sent out a list of acronyms. A lot of those acronyms come out of her division. In addition to doing wraparound programming, they also are responsible for adult productive services. And you will notice that in 2021, they had a lot of referrals for those who are 60 and over. Keep going. So this is a chart. Our adult protective services worker is also responsible for guardianships, protective placements, and WATS reviews. In general, there's been an increase in WATS reviews and protective placements. Guardianships have decreased because the state has come out with supported decision-making, encouraging individuals to have a supported decision maker instead of doing full-blown guardianship because you're again taking rights away from individuals. Coordinated services is on the far right is 2021, and you'll see that they've had a significant increase in the number of individuals that are being served by their programs. They had almost an 11% increase in cases over the last year for 2020. Coordinated services is a lot of the programs they operate generate revenue. We'll talk a lot about CCS throughout the year. Individuals in the CCS program, that is a 100% reimbursement program for allowable costs. So a lot of dollars going to serving that program, and we were able to capture several of those dollars, and they offset other costs across the region. Keep going. And so all of those staff have billable standards where we expect them to meet a minimum threshold, so they're able to offset costs. And then we'll do the rest of the annual report in our next meeting, and then to just highlight at the end of the annual report, you'll find our 2022 goals. Way down there, page 49. So you'll find our goals, and then you'll find access to the services we provide, a little more information about those services, and then our surveys. Many of our programs require surveys, and we included some information about our survey results. So I know that was long. Any quick questions on that? Okay.
Any questions of Kelly on anything right now? No? Okay, we're scheduled for a tour of the building here. But if there is no other business, I will adjourn the meeting to do the tour. Our next meeting is scheduled for June 13th. Will that work for everyone?
Did you want us to do a quick update of the nutrition program? Bob had asked a question at the last
It's a
meeting.
very quick answer.
It's like 3 seconds.
Okay.
So Bob, you had asked at our last meeting, when I gave a update on our nutrition program about the cost to the county levy from our nutrition programs. So based on the 2021 data, and looking at our grants, our program income, which is our donations, and our in-kind dollars, that was about 95% of the cost, leaving county levy to pay about 5%. So I have those numbers if you want to see those, but that's the straight and narrow of your question.
Thank you.
Thank you.
Okay, we're adjourned.
Ma'am? Boss man?
Tuesday, Wednesdays, and Thursdays. I was still on Wednesday, we're gonna make the best.
There's